Step 73, IVF add-ons. IVF add-ons are treatment interventions which are not necessary in IVF treatment and which may reduce your chance of success. On social media, you may get advice from other patients on using some of these add-ons because they usually give advice if they had a success while they were using the add-ons. Generally, they didn't get a success because of these add-ons. They got success irrespective of using these add-ons or despite using of these add-ons, because it was found that none of these add-ons were beneficial in terms of improving your success, and some of these add-ons may reduce your chance of success in IVF. Each patient has got their own probability of success in each cycle, so using some harmful add-ons may tip the balance in such a way which may reduce your chance of success in that particular IVF cycle. If you get advice on add-ons, you should go straight to this HFA website. That is a UK regulator of IVF treatment. They produce most reliable, most evidence-based guidance on add-ons after very thorough research of all scientific evidence. So they didn't find any of these 13 add-ons would improve your chance of success in IVF. It is not clear if endometrial scratch, embryo glue, or elective freeze all will improve your chance of success because there wasn't any sufficient evidence on these interventions. It was found that PGTA, ERA, immune test, immunoglobulin, and prednisolone may reduce your chance of success in IVF, and there is not enough evidence on effectiveness of intralipids, IMSI-assisted hatching, and there is no beneficial effect of PICSI and time-lapse embryo imaging. When you get any advice on add-ons, I strongly recommend you should go to that website and read for yourself on the scientific evidence on effectiveness of these add-ons, so that you do not end up using add-ons which may actually reduce your chance of success.